Hi everyone, Hannah here from Preferred Physical Therapy, where we help people age 40 and above stay active and independent, live free from painkillers, and avoid surgery. So I am here to teach you 2 movements or exercises that you can do to test out to see how well your hip mobility is. The 2 movements I want to look at are external rotation and extension of the hip. And you may notice these movements are difficult if you're sitting on the ground, maybe in like a butterfly position, or even trying to get your foot up so you can put your shoes on, or with the extension if you're trying to get up off of the ground or even down on the ground too. So I'm going to show you what those are. So this first test is to look at hip extension, and I'm going to be using a lunge position to really test out that mobility. So in a lunge here, the first thing you want to do is make sure that you're holding a pelvic tilt the entire time. If you break the pelvic tilt or if your weight starts to shift forward, that automatically means that you have restriction in the hip. And the leg that's backwards, that is the hip that you are testing. So in my lunge, holding my pelvic tilt, I'm going straight down to the ground as far as I can, hopefully touching the ground and then coming back up, again without losing that tilt, or if you're here and you really start to notice that shift forward. So again, keep it here, up and down. You want to be able to do that slow and controlled without losing that balance, and testing out both sides to see how each side feels. This next one is to test out external rotation of the hip, and this one's important. Like I said, if you're sitting in a chair trying to get that leg up there to put on your shoe, or if you're down on the ground with the grandkids and you have to go into some type of butterfly stretch position. So to get into the position here, you want both feet in together. You don't want to start with the feet out or any weird position here. You want to stay up nice and tall and not use your hands. And starting with one side, you want to see how far down you're able to push that leg without rotating, or again, without having to use your hands or leaning backwards. So it's about seeing how far from the knee to the ground you can get, testing out both sides. And you can easily use your fist to test it, or if you want to get creative, you can always have someone pull out a ruler for you and actually track the progress that you have. So if you notice that one side can get down pretty far and then the other side you're really pushing and there's a huge difference or a huge gap side to side, that's when you know you're really restricted on that one. Normal is about a fist width between the knee to the floor. So I hope you are able to try out these exercises. If you do notice that you're struggling, having pain, or really noticing limitation, you can always give our office a call, check out our website, or head over to YouTube, where we have a whole library of videos of exercises and movements that you can also look at as well. Have a great day.